Hello, everyone, and welcome to another audio and podcast under this series, the LabZtorm Impact V2. And as part of this audio podcast, I'm going to provide an overview of the HC 2014 conference, which was a link between healthcare professionals and those who had expertise in areas of integrating healthcare practices through information technology and in line with areas of electronic patient records, but also in relating to in relating to in relating to general areas of sort of sort of healthcare practices between different healthcare sectors, and to begin with, I'm going to provide a sort of an overview in context of the remit of what the HC2 2014 conference was about. This is a Storm Robotics production in collaboration with the Renal Patient Support Group, the RPSG. So this was actually an event that took place, the HC 2014 event. It took place in Manchester, Northwest, in 2014, and it really aimed to involve those who involves stakeholders in transforming healthcare through the best use of sort of technology, and provided a forum where policy and decision makers were able to network with prominent suppliers in the sector. So there was a robust five stream educational conference featured the participation of leading National Health Service organizations and royal colleagues with royal colleges with keynote addresses from senior sector figures in the National Health Service and government, including Justin Whatling, who was the chair for the British Chartered British Chartered Society for Computing and Computing Health, and Computing in Health, and University of the University of California at Los Angeles, Andrea Spryopolous, and then president of the Royal College of Nursing, and Tim Kelsey, who was NHS England, and Kingsley from NHS England, and Kingsley Manning, who was the chair of H&SCIC, which is Health and Social Care Informatics committee organization. With plenty, there was quite a few opportunities for networking and for areas of professional development through the key through sort of the main through the main sort of main area around the HC 2014 sort of outlay, and provided the dynamic environment with sort of a variety of interactive presentations workshops and supplier encounters. It was an ideal opportunity to sort of meet and share ideas and experiences with colleagues and those who develop and supply technologies around areas of healthcare practices. And so, in line with the HC 2014, I thought I would also provide kind of a brief idea of the kinds of speakers and themes that were involved. So there was so this was again, there was a National Health IT conference and exhibition that took place in Manchester in 2014, and so the plenary involved Justin Whatling, who was the chartered the chair for the Chartered Institute for IT, Information and Technology, and Tim Kelsey, at that time the National Director for Patients and Information at NHS England, and Andrea Sutcliffe, who was the Chief Inspector of adult healthcare, in line with the Care Quality Commission. And so the initial, or the first part of HC 2014 had for example presentations around integrated working across healthcare professionals and sectors, and there was under that particular theme, there was presentations from 3 different speakers on 3 different topics. So there was a presentation around the pre-hospital environment, the impact of informatics across the acute stroke pathway, integrated pathway, and then an integrated pathway of care for stroke patients in a particular area in the United Kingdom, and then in stream two, or part 2 of the another particular area was where the theme was clinically led transformation, service and practice, and there were 3 presentations around this in this theme. This was clinical transformation, strategic principles and lessons. There was a presentation about rolling out electronic prescribing, and there was a presentation around clinicians, collaboration and big data, exploring the new multidisciplinary team. Another theme was around what was known as the mind the gap, which involved presentations from the Royal College of Physicians, looking at record standards. There was one around transition from paper to electronic patient records, what are the requirements and standards. And there was part of this at the time, there was an expert panel that took particular questions, and the panel mainly consisted of those who were from the Salford Royal Hospitals Foundation Trust. Salford Royal Hospital Foundation Trust is within the Manchester region as well. And then another theme was fit for practice, exploring the nursing experience of the usability of clinical systems. And there was a presentation around usability, and there was a presentation around the content for nursing. Then the final theme around around the first set of presentations was have your have your information systems got the P factor, and the P factor relating to the patient factor, I believe. And so I looked at the benefits of designing healthcare information systems for patients with patients. There were three presentations here. Number one was where has the patient and service user user where has patient and service user worked well to date, and it was a tale of two different cities. And then there was a presentation around applying the lessons and benefits of renal patient view. I mentioned renal patient view or patient view in a previous audio podcast in this series. And so it was applying the lessons and benefits of renal patient view in other specialties, and the experience of again the Salford Royal Hospitals Foundation Trust. And then there was a presentation around supporting the self-management of an interaction with people with sort of mental health, learning disabilities, and other healthcare conditions, and the impact of My Health Locker in London. My Health Locker is another sort of IT information technology interface that stemmed out from a team based in London. The second a lot of presentations related to the same theme, the same sets of theme, and the presentations were not all that different in relating to the first lots of themes, the first lot of presentations. However, there were some intriguing ones, including sort of there was some presentations around the patient perspective and the importance of integrating care, and that came from someone who represented the Stroke Association. There was some context around in another theme in one of the other themes around the UK Faculty for Health Informatics and improving patient outcomes through information technology. And there was a presentation around there and back again, and information governance through the National Health Service and independent sector. And there was another intriguing presentation around healthcare information systems and websites accessible and usable for all. So it was about viewing and resolving accessibility challenges from a server user's perspective, and the role of the one voice for accessible ICT information communication technology coalition of charities. One of my colleagues who was representing an organization called Robo Braille. His colleague was someone called Howard Lister. He had his own challenges, and he talked about sort of the Braille aspects of the Braille aspects and of sort of interlinks between accessibility in representing Robo Braille, but linked with an organization known as One Voice as well. And there was presentations from presentations, also around the sort of joining up healthcare and healthcare at patient level. There was an NHS England symposium specifically to specifically to the use around the use of data in healthcare, and there was a presentation around the impact of electronic records on clinical coding, and embedding informatics in clinical curricula, and there was a presentation under a theme, whereas it was a particular panel event where it was themed as fit for practice, exploring the nursing experience of the usability of clinical systems, and it was a series of presenters under that theme. And then there was a theme around have your again around that theme, have your information systems got the P factor, and there was presentations around developing new patient-centered digital health and digital services. Now, what's in it for us? And then there was a presentation around a sort of a patient view of digital health, and then there was the presentation around a patient view of digital health came from those who were representing an organization known as the Patient Association, and one of the colleagues that represented the Patient Association did have a GP, general practitioner background, and it is someone that I have collaborated with in previous in research that was which was sort of in a run up to this, and basically during that time, as mentioned in one of the previous audio podcasts, it was about the questioning how primary care could be integrated for the better. So it talked about in that paper publication, which was collaborative with the colleague from general practice, and looked at again the sort of the library services entity, and how that could be a neutral environment, or a mutual environment for patients and carers, etc., to access resources, and kind of in some context, though it wasn't outlined from the outset of that particular peer review publication. At the time, it wasn't really outlined from the outset, for example, whether it should replace whether library services and those as neutral environments should replace, for example, surgeries or doctor surgeries, for example. But ultimately, the peer review publication that contributed to a book chapter in 2014 did imply in some context that would be more advantageous than doctor surgery, because not everyone, for example, can get to for example, doctor surgeries, whereas sort of library services were were and had been retrospectively or historically more accessible generally. So this colleague talked a little bit about HC2 at the HC2 2014, talked about sort of a patient view of digital health, talking a little bit about sort of the literacy aspects, amongst other aspects, in representing an organization known the Patient Association. And there was a presentation around raising patient intrigue and uptake in primary care, and the partnership of trust, and there were there were there were there was a there was presentations by in relating to child protection, information sharing, and then there was a presentation about in relating to making data sharing making data sharing a reality, and then there was a presentation around, for example, in relating to NHS England. It was an NHS England symposium, and there was a briefings and facilitated discussion on GP IT, information technology, and patient online. Patient online is another sort of service where patients in the United Kingdom can access or use to get their to access some of their medical or clinical history, so that in run up to particular meetings or appointments, etc., with a healthcare professional, they can use that, and it's specific to primary care versus secondary care. And again, in a previous audio podcast, I mentioned how in relating to specifically around electronic patient records between healthcare sectors. Unfortunately, we're now in 2022, and still there is as far as hardware goes, there's still actually issues around the sort of integrative aspects, because primary care medicine and secondary care medicine only really actually only really integrated when individuals, patients, carers, etc., have absolute detriment to health. That's when it's actually important between healthcare sectors. Prior that, between healthcare sectors, all they really do care about is developing systems, aspects of technology that make their organizations and remits around healthcare are imaged well, and not so much around best practice, unfortunately, and that's historically been one of the biggest issues, generally speaking. And then there were presentations around is your data sort of is it ideal for sharing, so issues and concerns. There was a presentation around the litigation aspects in the National Health Service, and there was presentations around clinical document standards and sort of the policy perspectives. And then there was some presentations that came from from sort of the for the from the from the sort of there was a patient based theme in this HC 2014. So for example, one of the presentations, what's next, bringing good practice to life in new digital health and care services. There was a presentation around patient use of digital services, driving IT across information technology across healthcare, and there was a presentation around designing the new digital health and digital digital health and care service for patients with patients, and it was a presentation by a few representing NHS England. Generally, this theme was around for patients by patients, but there weren't from on recollection. It was chaired by a general practitioner, and did not actually have any patient speakers or presenters under that theme, as far as I can recall. I could be mistaken, but as far as I can recall, there were no patient speakers under that particular theme. And then finally, there were a few more presentations, and as I flick through the sort of different series of presentations that took place at HC 2014. There were also what are known as sort of fringe events, which were basically where those attending had opportunity to interact with different exhibitors and organizations representing particular remits around healthcare, and there was sort of part of the HC 2014. There was a best practice theatres, and it featured two best practice theatres located with the main exhibition main exhibition area at Manchester, within the main Manchester Central sort of arena. And it was a less formal interactive style of debate that took place within the two sort of best practice theatres during the two day event that took place. And NHS colleagues look to share their success stories around information technology implementations, and where real benefits to organizations have been recognized. And some of the sponsors around the conference look to join the speakers and presenters to assist the debate and questions around different areas of practice and solutions. And delegates, those who attended the HC 2014, had the opportunity to go around looking at the different exhibitions, to drop in and out of in between different parts of the conference remit. And in line with this, the Renal Patient Support Group, the RPSG, was lucky to actually have was fortunate to be kind of a central part of the HC 2014 with its own booth in collaboration with the British Chartered Society of Computing, the Chartered Institute for Information and Technology, and had a booth with the BCS, and where different health professionals, or different professionals between health sectors were able to approach those representing the Renal Patient Support Group, or the RPSG, to find out more about areas of practice, and so it was a real opportunity for the RPSG to highlight and sort of highlight areas of practices between not just between sectors, but also how patients and carers and health professionals, researchers, investigators, etc. are using the RPSG, or have been using the RPSG platform as a way to learn, learn and do and implement areas of practice within and specific to their own health sectors, to ensure that the patients sort of a remit are actually documented and actually deemed as one of the most pinnacle aspects of healthcare practice. And so generally the remit allowed a good kind of a good a good overlay of where health professionals and sort of IT professionals and etc. Were able to interact and learn. And so following this, however, shortly after this, it wasn't till probably after 2 years, around 2 years after HC 2014, as time went on, the RPSG did actually develop a peer review publication that went into that contributed in as a peer review publication in a peer review journal, and it was relating to sort of links between chronic conditions and disabilities, and looked at discrimination aspects, as well as looked at ignorance and discriminatory aspects around different sort of accessibility aspects around healthcare between health sectors. And so one of the other colleagues who knew very well, sort of very well around the works around the Renal Patient Support Group, RPSG, who I've mentioned in this audio podcast, and it was a fellow, it was another academic representing from Malta University, and the founder for the kidney disease and renal support group, or KDAS for kids, and myself, collectively together we developed a peer review manuscript on the ignorance and discrimination around sort of chronic illnesses and disability, and it was peer reviewed and published. The works is available through the RPSG. It was presented as well. The works was presented at the European Society of Pediatric Nephrology, which took place in 2016 as well. And generally, we talked about in that peer review manuscript. There were some reflections based on HC. The HC 2014. So I thought I'd mention it a little bit briefly, a little bit in this audio podcast, because there is a sort of a link between aspects that relate to that. So generally the HC 2014 and what followed was what had followed up to 2015 and 16 were actually very sort of constructive in line with areas of healthcare practices, and allowed the RPSG to actually develop sort of those important sort of networks in relating to collaborative efforts. And so finally, I'm just going to read an overview of another sort of part of an editorial that was published in the Journal of Kidney Care around 2016. This was was published. It was in peer review publication in the Journal of Kidney Care. This peer review editorial was available through the Renal Patient Support Group, the RPSG, and it was published in 2016 as well. So I'm just going to read a little bit from this paper to draw this audio podcast to a close. So this is an editorial titled "The Future of Renal Patient Support is Bright." And so it was in 2009 the RPSG was initiated by 3 colleagues, and to help raise awareness through primarily a Facebook group to support patients and carers so they share experiences in confidence and become more empowered. The group has grown, and at this time in 2016 it had just over 7,000 members globally. Its co-founders initiated a blog as a way to interact with sort of non-Facebook users in 2012, and as well as the ResearchGate page, which lists a list of various publications from around 2015, again from non-Facebook users and academics and researchers. And some priorities for the RPSG in following the 2014 up to 2017 included seeking funding, looking to seek for funding to pilot sort of online consultations through social media, and for an art book which would look to aim to highlight chronic kidney disease health in a more visual way. And thus, in addition to several research proposals, the RPSG would look to highlight sort of the broader health issues, issues through collaborations. It would focus on the publication and dissemination of work through sort of conference remits and through media, for example, radio stations. And the RPSG would also look to contribute more knowledge, highlighting shared decision making to collect data through the UK Renal Registry, and also how best to conduct clinical trials through the UK Renal Trials Network, or the RTN. And with a growing older population, chronic kidney disease prevalence is still a general concern. The RPSG would look to focus on contributing evidence-based care practices and integrating of knowledge in a more broader sense. So this was an editorial that was peer-reviewed and published in the Journal of Kidney Care. It's available again through the RPSG, and I want to say thank you for taking the time to check out this audio podcast in this series, the LabZtorm Impact v.2, and with an overview of the HC2014 is the Shientist, and it's been another Storm Robotics production with the Storm Robotics production in collaboration with the Renal Patient Support Group, the RPSG. Thank you for taking the time.